and palpate the scalp, hair, and cranium. I'm just gonna look in your head. Next, I'm going to inspect face, expression, and symmetry. Could you smile? Next, I'm going to palpate the temporal artery. I'm just going to touch your face. I'm going to assess the eyes by first testing the visual fields by confrontation. Can you read that bottom line?
Do I need to cover my eye?
Yes. Could you cover your right eye?
E Z O P Q.
Good job. Could you cover your left eye and do the same?
I can't really see. I'm going to have to go up.
Just read the clearest line you can read.
Q R Z H S.
Good job.
That's what I can see.
Thank you, ma'am. Next, we're going to test the extraocular muscles, the corneal light reflex, 6 cardinal positions of gaze. Did you follow my finger? Next, we're going to inspect the external eye structures. Next, we're going to inspect the internal structures of the eye. Just come look in your eyes. Next, we're going to test the pupils for size, response to light, and accommodation. Next, we're going to assess the ears of the patient by first inspecting the external ear for position and alignment, skin condition, and auditory meatus. I'm just going to look at your ears. Next, I'm going to move the auricle and push the tragus to check for tenderness.
Tenderness.
Next, I'm going to take the otoscope and inspect the canal, then the tympanic membrane for color, position, landmarks, and integrity. Just going to look in your eye. And yeah, your inside.
That's fluid.
Next, we're going to test the hearing by doing the whispered voices. So I want you to cover your right ear, and I'm going to whisper in your left ear, and you tell me what I said. Did you repeat the word I just said?
Can you say it again? Alright.
And could you cover your left ear?
Smile.
Now we're going to move to the nose part of our assessment. We're going to inspect the external nose for symmetry or lesions, which she has no lesions and her nose is symmetrical. And next we're going to inspect the facial symmetry. Could you smile one more time? All right, thank you, ma'am. And next we're going to check her nostrils for patency. Both nostrils are patent. And lastly, with the speculum, we're going to inspect the nares, which include the nasal mucosa, the septum, and the turbinates. I'm going to pretend with this. So I would open it up and then inspect. So we're going to move to the mouth and throat portion of the assessment by first taking a pen light to inspect the mouth. Just say ah. Next, we would grade the tonsils as present, but hers are not present. Next, we're going to note mobility of the uvula as the person states ah and test gag reflex, which she just did. Next, we're going to ask the person to stick out their tongue. Could you stick out your tongue? And lastly, if we would do this, we would do it with a gloved hand and by manually palpate the tongue if indicated. Next, we're going to go over the neck assessment. First, we're going to inspect the neck for symmetry, lumps, and pulsation. Then we're going to palpate the cervical lymph node. Next, we're going to inspect and palpate the carotid pulse, one side at a time. We're then going to palpate the trachea and midline. And lastly, we're going to test range of motion and muscle strength against my resistance. So she's going to lean her head forward and back and turn from side to side and shrug her shoulders. So move forward and back and shrug the shoulders. Okay. We're then going to palpate the thyroid gland from a posterior approach. Next, we're going to assess the anterior chest First, we're going to inspect respirations and skin characters. So I'm going to observe her chest, and if I was able to look at her chest, then I would inspect the skin characters. Next, I'm going to palpate. Then I'm going to percuss the interior lung walls. And exhale briefly. Next assessment is going to be the posterior and lateral chest. We're going to start by inspecting the posterior chest. Next, we're going to palpate. And next, we're going to palpate the length of the spinaceous process, followed by percussing over all the lung sounds, the lung fields. Next, we're going to percuss the costovertebral angle, noting tenderness. And lastly, we're going to auscultate breath sounds, comparing each side. Next, we're going to assess the upper extremities by first testing the range of motion and muscle strength of hands, wrists, arms, and shoulders. Could you wiggle your fingers? Can you grip both hands? Flip your wrist. And shrug your shoulders. And next, we're going to palpate the epitracheal nodes. Next, we're going to palpate temperature and cap refills. And we're going to lastly compare radial and brachial pulses. I'm just going to tap. And next, we're going to auscultate breath sounds, comparing them from side to side. Next, we're going to assess the heart by asking the person to lean forward and exhale briefly while I auscultate the cardiac base for any murmurs. Next, we're going to palpate temperature and cap refills. And we're going to lastly compare radial and brachial pulses. Next, we would assess the female breast by inspecting for symmetry, mobility, and dimpling as the woman lifts her arm over her head and pushes the hands on the hips and leans forward. Put your hands over your head and then put your hands on your hips and lean forward. And I would be inspecting your breast at that time. And next, we're going to inspect the supraclavicular and infraclavicular areas. Next, we would palpate each breast, lifting the same side arm up over the head. I'm not going to touch her, but I would palpate that breast, and then I would palpate the other. And then we will palpate each nipple for discharge. And then support the person's arm and palpate the axilla and regional lymph nodes. And lastly, we would teach her how to do a self-breast examination. Assessment will be the neck vessels. So we're going to inspect each side of the neck for a jugular venous pulse, turning the patient's head slightly to the other side. Our next assessment is going to be the heart assessment. We're going to start by inspecting the pericardium for any pulsations or heave. Next, we're going to palpate the apical impulse and note the location, as well as palpate the pericardium for any abnormal thrill. Next, we're going to auscultate the apical rate and rhythm. And then we're going to auscultate with the diaphragm or the stethoscope to study heart sounds. Next, I'm going to turn her to her left side while auscultating the apex with the bell. Okay, could you turn back on your back, please? Next, we're going to assess the abdomen by first inspecting. I'm not going to lift her shirt up, but I would inspect for symmetry, skin characteristics, the umbilicus, and pulsations. And then I'm going to auscultate the bowel sounds. Next, I'm going to auscultate for vascular sounds over the aorta, renal arteries, iliac, and femoral arteries. Next, I'm going to percuss all 4 quadrants, as well as percuss height of the liver, span in the right mid-clavicular line, and percuss the location of the spleen. Next, I'm going to do a light palpation in all 4 quadrants, then deep palpate. I'm going to do a deeper palpate. And now I'm going to palpate the liver, spleen, and kidneys, and also palpate the aortic pulsation if it was needed. Our next assessment is going to be the inguinal area. The first thing I would do is palpate each groin for the femoral pulse in the inguinal nodes. Next, we're going to move to her lower extremities. I would start by inspecting them for symmetry, skin characteristics, and hair distribution. And then I would palpate the pulses. Next, I will palpate for temperature and pretibial edema. I would then separate her toes and inspect them. And also I would test the range of motion and muscle strength of hips, knees, ankles, and feet. Could you lift? Good job. And could you push my hands with your feet? All right, could you sit up on the side of the couch? And as she's getting up, I will note her muscle strength. And next, we're going to assess neurological status by first, by first testing the sensation in selected areas on the face, arms, hands, and feet for superficial pain by light touch and vibration. I'm going to touch your face. Just tell me when you feel it.
I feel it. Feel it. Good job.
And next, I would test position, sense of finger. And next, I would test stereognosis using a familiar object. Can you close your eyes? Good job. Next, I would test her cerebral function of the upper extremities using finger to nose test or rapid alternating movement test. Are you good? Okay, good job. And next, I'm going to test her cerebral function of the lower extremities by asking the patient to run each heel down the opposite shin. Perfect. And then I'm going to elicit deep tendon reflexes. Need something to hit it. I'm going to tap. And then I'm going to test the Babinski reflex. I'm not going to touch her feet, but I would do that next. Next, I'm going to inspect her lower extremities and just inspect the legs for varicose veins, which she doesn't have. And next, we're going to move to the musculoskeletal system. And I'm going to ask the person to walk across the room in her regular walk, turn, and then walk back towards you in a heel-toe fashion. Mm-hmm. Next, we're going to ask the person to walk on the toes for a few steps, then to walk on the heels for a few steps. Good job. And then we would stand close and check drawing bird sign. Put your hands to your side. And feet a little bit closer. Okay. Bare minimum swing. Good job. Then we would ask the person to hold the edge of the bed or couch and perform a shallow knee bend, one for each leg.
Yes.
Thank you, Lydia. You might, you might have to hold that, the edge of that. A shallow
Just
knee
bend?
bend with one leg at a time, I guess. Yeah.
Oh.
And then I would stand behind her and check the spine as the person touches the toes. Okay. And then I would stabilize the pelvis and test range of motion of the spine as the person hyperextends, rotates, or laterally bends. Good job. I would then inspect the female genitalia, which I am not going to do today. And this concludes my physical assessment. Thank you for watching.
Yay!